My name is Naomi Matsuura. I am an associate professor in Materials Science Engineering and Biomedical Engineering at the University of Toronto.
My name is Yasufuku. I'm a thoracic surgeon. I'm a professor of surgery at the University of Toronto. I'm also the chairman and division head for thoracic surgery at the University of Toronto.
Biomaterials engineering is a field of study in which we engineer new kinds of materials that interact with biological systems. In my case, we develop materials for diagnosis and therapy to treat human disease. So lung cancer is the leading cause of death in Canada. And the way lots of cancers are treated is via what we call chemotherapies or drugs that we inject into the bloodstream. And that is non-specific typically. So it goes everywhere in the body. So healthy cells can also be destroyed by these kinds of drugs. So what happens is if you can more locally deliver the drugs to the tumor, that can reduce the side effects that lots of patients go through, as well as deliver more therapy to that tumor. So that's the problem we're trying to solve by using our bubbles with chemotherapy for delivery and the EBA system.
This is where our collaboration started. There is a procedure called endobronchial ultrasound, EBUS, and this is something that I co-developed with Olympus about 23 years ago, and now it's become the standard of care for tissue diagnosis and lymph node staging of patients that could potentially have lung cancer or patients that have lung cancer. And it's a method to use the ultrasound, which is on the tip of the bronchoscope, to go inside the airway, go into the lung, and use a fine needle to sample lymph nodes. It really has totally changed the way that we manage patients with lung cancer. Because of that, I have had a lot of interest in using endobronchial ultrasound for different methods of treatment and diagnosis. And this is where the collaboration started, using this endobronchial ultrasound technology and pairing it with a new technology that Naomi has, Microbubbles.
So in our lab, we design new materials that interact very specifically with different kinds of radiation sources. One of them is ultrasound. So what's really interesting is you can design these materials that you can both see with ultrasound and you can activate with ultrasound. So uniquely, because we have this amazing EBA system, or the EBUS system developed by Kazu's group, we're able to think about how we can apply these bubbles, which have been used in other types of cancers, in other body parts, but not in the lung before, and combine it with Kazu's expertise and see if we can use the EBUS treatment not just for staging and diagnosis, but also for therapy.
One idea that came up as we started to talk about potentially doing something together was using this endobronchial ultrasound technology to enhance delivery of chemotherapy into the cancer. And it just has never been done. And it came after some discussion when we were part of the thesis committee for a graduate student. And as we were waiting for the graduate student to come, we started to chat about what we do. And that's how we kind of developed this collaboration.
Yeah. And then we had the EMH seed opportunity come up, so we decided to apply for it. And we were able to receive it, and that gave us the opportunity to move forward with this idea. And it's interesting because it does seem quite simple in retrospect, but no one had tried it. And it's two totally different areas that didn't tend to overlap. What's interesting about the endobronchial ultrasound system that Kazu helped develop is it goes into the body. And so in that way, you can actually access your lung or lung cancer tumors, which are really hard to do from outside the body because the air in your lung prevents the sound waves from penetrating into the lung. So it just happens that we had this little intersection where we both are working on a little slice of research that seemed to work very well together, where he has the equipment and the expertise of the lung cancer, and we have these agents that we were using already to treat different kinds of tumors.
so far it's been a really great collaboration, and I think there's going to be a lot of great things coming from this collaboration.
If I had to use one word to describe engineering research at U of T, it would be innovation.
It's really about innovation which impacts patients. And I think we're very good at that. You know, if you're just in your lab doing your stuff and you don't have collaborators, you don't go anywhere. And you know, we have so many bright people and smart faculty, and it's really about the collaboration that really makes us very strong and unique, I think.
And I think it's a willingness to collaborate as well, right? It's the willingness to try to learn something new, step out of your comfort zone, and listen to someone completely in a different area and try to work together to find a solution. So it takes a lot of humility and you know, a lot of courage in some way to step out of what you're already doing to try something completely new.